Good morning, everybody. I just woke up right now. It is 5:30 p.m. in the afternoon. As you can tell, I am still on night shift. It is rough, to say at least. I actually like being on night shift as a nurse, but like outside of work, it's a mess. Like, I don't know what day it is. I don't know what month it is. I don't know what year it is. Nothing. I don't know what's going on right now. Like, when you're on night shift, nothing in your personal life matters because you're just focused on sleeping, and maybe eating in that time. And for the moment, I am getting better at this right now because I slept until the afternoon. So I probably won't need as much coffee. However, I did wake up at 5:30 and we need to get ready right now because we have like 30 minutes before I have to leave. So let's do this. Let's put on our scrubs. Thank God I washed this earlier today because if I didn't, I wouldn't have any scrubs right now. My hair is absolutely crazy right now. I definitely need a haircut. Like, it is so long. Like, check this out. Like, it is crazy right now, and I definitely need a haircut stat, but I'm just cheap and I don't want to pay for it. So I'm gonna try to cut it myself, and I might make a video about that because it might go horribly. And now for the most important part, my skincare, because at the moment my skin is breaking out right here and right here. Whenever I'm on night shift, I don't know about you guys, that is when my skin breaks out. Like, on day shift, I can wear the same mask for a month straight, no breakouts, no zits, no whiteheads, nothing. But the second I'm on night shift and I drink a cup of coffee, bam, it breaks out right here and right here in my jawline. My skin's clear, like right here in my nose, it's clear in my forehead, it's clear right here, but it's just like right here in this area is where it breaks out. And if you have any tips about how to remedy this, help me out. Because right now, all I'm doing is my skincare routine, which is washing my face, moisturizing. This is my Vanity cream. I love this stuff. You can get it from Target. And I've been using this new prescription called Finacea, which is a azelaic acid. And it's been working pretty well, but the real cause of my acne I know is night shift because I just drink so much coffee and I snack so much. I gotta stay awake somehow. So in 2 weeks from now, when I'm on day shift, my skin's gonna clear up and I'm so excited for it. Now for the best part, my headband. So people ask me all the time why I wear this. It's because my hair gets so long and gets into my face and it's really annoying. It's just super annoying, so I just wear a headband and it solves all my problems. I do wear one from Rogue Fitness. You can probably see the label right there. It's like literally almost fading. But if you got any suggestions, let me know because I'm open to all kinds of headbands because I'm a huge fan. And just like that, we're good to go. Oh, someone just woke up. Dude, come on, you gotta wake up, man. Hey dude, you gotta wake up. You gotta wake up, it's almost 6 o'clock. Come on. You're so cute now. But seriously, you're gonna be up all night long, be a demon to your sister. You gotta wake up. And just like that, we're all ready to go. And as you can see, I take little to no time to get ready. Like, I can do my skincare, get dressed, get some food down in like 20 minutes or so. And as long as I'm feeding the cats, that's really the most important part. And at the moment, I'm gonna make a quick protein shake and then I'm gonna head out the door and I'll see you guys in a second. And of course, it's raining and all gross out right now. Like, I like winter, don't get me wrong, I love winter, but it's been super gross out recently and I don't know, I'm kind of missing summer right now. Like, I want it to be like 70, 80 degrees at the moment, that'd be perfect. Let's just make it into the car and be safe. Whew. And now we sit in here for about 20 minutes as the car warms up because I can't drive when I'm freezing. All right, just got to work, but before I go on, I want to talk about something. I get a lot of comments on every single social media platform about, hey, I'm a new grad nurse and I don't know what I'm doing. I feel like I'm a failure and I have so much pre-shift anxiety. And let me tell you this, it is so normal to feel like you don't know what you're doing, feeling like you're an imposter in your first year of nursing. Trust me, it is so normal because nursing school doesn't teach you how to be a nurse. Sounds crazy, right? But it does teach you how to pass the NCLEX so you can be a nurse. And really, in your first year of nursing, that's when you're really learning everything, basically. And it is so normal to go in your first day and be like, I want to throw up right now because I'm so anxious. That was me, honestly. Like, I was literally gagging in my car because I was so nervous about going to work and I didn't know anything. Like, you're telling me I'm a new grad nurse and I have to go into the hospital right now and take care of a patient who is intubated? Like, I've only seen that on TV in clinicals. Like, and honestly, the best thing for pre-shift anxiety is just time. Like, you really just have to feel confident as a nurse and that kind of goes away slowly. It doesn't really go all the way because, you know, everyone has anxiety, but definitely after your first year, like, or even after orientation, honestly, you feel so much better because you actually know how to do your job now. And you just have to remember that it is so normal to feel this way. Everyone in your cohort who graduated with you feel the exact same way, and you're not alone. And as long as you have a really good preceptor, a good manager, and some really good friends by your side, you're gonna be all right. You're gonna be fine. Just take your time and ask questions. Now it is my time to go into work, so I will start recording and give you an update around like 2 a.m. to see how I'm doing. I can't really record anything until like my lunch break because I don't want to get in trouble. So I'll see you guys then, and hopefully I'm still alive. All right, it is 3 a.m. now. My brain is barely working at the moment. We're in this fancy conference room, so I can kind of get away and just talk to you guys right now. So far, it's been a really good night. No rapids, no codes, just so many kids with RSV and flu. If you don't know, I'm a pediatric nurse working in the ER right now, and it is crazy right now. Like right now, we are swabbing kids who are not even symptomatic at all. The parents are just like, hey, can you just swab our kid just in case he has RSV? And we're like, yeah, sure. I swabbed the kid, he's perfectly fine, healthy as ever, just there for leg pain, and literally positive for RSV. But honestly, with night shift, like it really isn't that bad. The hardest part is staying awake. I need tips, you guys. I need tips bad because I don't know how to stay awake on night shift. I thought I was getting better at it. I really thought, but even sleeping until like 5 p.m., I'm literally still so sleepy right now. And I just don't get it. Like, I think my circadian rhythm is just so strong. It's just like bypassing all the sleep and caffeine I've got. People have told me to do some jumping jacks, drink caffeine. And honestly, for me, like I need to limit my caffeine. At a certain point, if I drink enough coffee and Red Bulls, I will start getting chest pains and I need an EKG stat and be admitted to the hospital because I will literally go insane. So most times I just try to stay busy. Like I will try to restock the unit. I'll help out my other patients if they need anything else. And at a certain point, I'm just bothering them because I'm just bored, you know? It is very tough, but if you have any tips, drop a comment down below because I could use any help for night shift. And yeah, my brain is not working, guys. I really feel like my brain is not working. I don't know how I drive home from work after this because if I close my eyes for like 5 seconds right now, I could fall asleep easily. Like, I could fall asleep in this chair right now with this camera recording and my boss will walk in and she'd be like, what did you do last night? So before my break ends, I want to answer one of you guys' questions on my Instagram. You guys asked me, how did you study for the NCLEX? So for me, I used the Saunders textbook in UWorld. That's it. UWorld has a really good app, so if I'm at work or on a bus ride, I can literally pull my phone out and start studying, and it gives a really good rationale. And that's really all I use, guys, and I studied for about like 6 weeks straight, and I passed the first try, and that's really it. And you have to remember, for the NCLEX, it really depends on what kind of exam you get because it's all randomized questions. So you might get all cardiac, all OB questions, but someone else might get all pediatrics and like ethics and psych. And that person might not do good in those questions, but do better on cardiac. I've had friends who failed the first time because they just got the worst questions possible. And on the second try, they literally passed in 75 questions, easy peasy. So it kind of depends what kind of questions you get. It's kind of crappy, but hopefully if you're taking the NCLEX soon, that you get the best questions for you and not the crappy like ethics and delegation questions, I don't even know. But hopefully that answered your question. I can get into it more later. Right now, my brain is barely working, and I'm gonna do a Q&A video tomorrow actually. But at the moment, I'm gonna go back to work, and I'll see you guys at 7 a.m. when I'm off work. We did it, guys. Right now it is 8 a.m. I'm back home right now and I'm about to head upstairs, and literally I am so tired. Thankfully in the last 4 hours it got a little bit busier. Like my baby was crying a bunch, so I just held her and fed her bottles all night long. It was awesome. And usually if I stay busy like that and the things to do, there's a lot of medications or blood draws or new patients, perfect. That's perfect for me because I need things to do to stay awake. And that literally got me through the rest of my shift. But right now, we are going to head upstairs into our comfy apartment, into our bed, and go to sleep. And thank you for watching this video, guys. This has been 12 hours as a pediatric nurse. But if you love these vlogs, let me know. Drop a comment down below. I'll make more of these, guys. So I'll see you in the next video. I love you.